Hi guys, today we are talking about inflammatory bowel disease, which are actually autoimmune inflammatory conditions affecting the GI tract with periods of remission and exacerbations. Now, I specifically emphasized conditions because we are talking about two different diagnoses that we look at that are together referred to as inflammatory bowel disease. All right, so the first one is called ulcerative colitis, and the second one is called Crohn's. And we're going to talk about the differences and then, of course, the therapeutic management for these. So first, we're going to discuss ulcerative colitis. Firstly, it affects the colon and the rectum. It can lead to poor absorption of nutrients. We see edema, lesions, and ulcers. We typically see 10 to 20 stools per day with blood and mucus. And we need to avoid foods that may exacerbate symptoms like raw vegetables, fruits, nuts, popcorn, whole grains, cereals, and spicy foods. Now, we're going to talk about Crohn's for a second. Crohn's can affect the entire GI tract, okay? So ulcerative colitis, we're talking about just the colon and the rectum. Crohn's can be all over. It may affect other body systems, especially skin and the lymphatic system. And it leads to a thickening and some scarring and some abscesses. And here we're going to see 5 to 6 stools per day, and they're going to be pus and mucus. All right, so let's talk for a minute about therapeutic management. First, there's some major medication classes that we're going to see. The first one is corticosteroids or methylprednisolone, which decreases inflammation. And the risk for Cushing's syndrome is present with chronic use of these. Another major medication class is the salicylates, i.e. sulfasalazine. It inhibits pro-inflammatory chemicals, prostaglandins, interleukin-1, tumor necrosis factor. And another medication class is immunomodulators, i.e. azathioprine or methotrexate. This decreases immune and inflammatory response and helps decrease the need for corticosteroids. And the last major medication class is antidiarrheals like loperamide, which will decrease the loss of fluid and electrolytes. We have some surgical options, bowel resection or colectomy. With ulcerative colitis, this can be curative, but with Crohn's, it's just palliative. And then another surgical option is surgical removal of the abscesses. So I want to just review again the major differences between ulcerative colitis and Crohn's disease. Ulcerative colitis affects the colon and rectum, whereas Crohn's affects the entire GI tract. Ulcerative colitis, we see poor absorption of nutrients, edema, lesions, ulcers, 10 to 20 stools a day, blood and mucus. In Crohn's disease, it may affect other body systems, especially the skin and the lymphatic. We see thickening, scarring, abscesses, 5 to 6 stools per day, pus, and mucus. All right, thank you so much, guys. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's NCLEXbook, NCLEXBOOK.com. Happy nursing!